Hello, assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel, that is Dr. Jahangir Khan. Well, this is a very important chest X-ray. How do you describe a chest X-ray? Now, description of a chest X-ray is something else, and diagnosis of a chest X-ray is something else. So, what do you see in this chest X-ray? So, there are nodularity in all the lung fields bilaterally. So this is actually a nodular pattern bilaterally involving both the lungs, upper, middle, lower zones, with some cavitation in between. There are some cavities as well over here. Can you appreciate these cavities? And there is a rim of hyperlucent area in periphery of middle and lower zone with no vascular marking. And can you appreciate this chest tube which is going all the way there? So there is a chest tube in place in the left side, and this is of course an artifact, mobile, lying in the pocket of the patient. So what is your diagnosis? This is a left side pneumothorax with chest tube in place with bilateral diseased lung. This was actually a case of miliary TB. So these are the mallets, miliary TB with left-sided pneumothorax, miliary TB with left-sided pneumothorax. So this is the way how you describe this chest X-ray. Now moving another chest X-ray. How do you describe this chest X-ray? So this is a chest X-ray of a patient XYZ taken on this date, who is having date of birth of this, and who belongs to suppose let's say for example Peshawar or Sawabi. So you have to individualize a person so that there is no mixing. So what are the findings with this? Can you see this trachea? So the trachea is shifted to the right side. Even the whole mediastinum is shifted to the right side. That is your first finding. I cannot appreciate the heart in this chest X-ray. So mediastinum is shifted to the right side and the heart is hidden behind these cystic changes. Can you appreciate these cystic changes, which is predominantly in the lower zone, with opacification on the medial aspect of the right lung in the upper, middle and lower zone, sparing the periphery on the same side. While on the left side there is a rim of hyperlucent areas predominantly in the mid zone and in the lower zone with no vascular marking and some nodularity. If you focus on this, you can appreciate some nodularity in the left upper zone. So what is your diagnosis? This is a case of left-sided pneumothorax. You can appreciate over here left-sided pneumothorax with nodularity in the left lung and the cystic changes in the right lung, and the trachea and the mediastinum shifted to the right side. This was a case of post-TB bronchiectasis with left-sided pneumothorax. Post-TB bronchiectasis with the left-sided pneumothorax. Post-TB bronchiectasis with the left-sided pneumothorax. Post-TB bronchiectasis with the left-sided pneumothorax. So the mediastinum is shifted to the right side because of the two reasons. One is the pneumothorax that causing the shifting effect on the opposite side, and the other is fibrosis on this side. Fibrocavitary lung disease that causes the pulling effect. So this patient needs urgent chest intubation because the lung is diseased and the patient is having these post TB fibrocavitary changes predominantly on the right side. So this was a case of post TB bronchiectasis. Thanks for watching. Please do subscribe my channel, press the bell icon so that you can get notification of my new video, and also share my channel.